St. Luke's Cataract and Laser Institute has a long-standing reputation for excellence in cataract surgery and eye care. Dr. Pitt Gills is here to give us a preview of the services they provide. Welcome to the show, Doctor. How are you?
Great. Thank you, Natalie, for having me.
Well, we're excited you're here. Unfortunately, couldn't make the last appearance because you had the flu, so I'm glad you've made it in now, because St. Luke's has been around for so long and really does stand for excellence. Talk a little bit about the practice and why that name is just goes hand in hand with excellent eye care.
Well, thank you. St. Luke's has been around for a while, like you said. My father started St. Luke's in 1968. And so it's been a real honor for the St. Luke's family to be able to serve the community and serve patients outside the community for over 50 years. And so part of that 50-year anniversary is we're going to celebrate that with a renovation that's going to basically focus on integrating new technologies and decreasing wait times, which is always a hot topic for patients. And so we're excited about this year, and we're excited about the future.
Wait times, I have no idea what you're talking about. I've never complained about that before. No, joking aside, I'm glad you actually brought up technology, because being a part of an organization for 50 years, I'm sure you've seen the advances that you've had in technology. Talk about those advances and how St. Luke's has really stayed up to the par.
Absolutely, and the patient experience really defines everything. So if you look at when St. Luke's began in the late 60s, the patient experience, it was an invasive procedure, it was a long recovery, the vision results weren't very good, and nowadays patients can go in with a very minimally invasive procedure, have better vision than they've ever had, and have more freedom from glasses than they've had in the past. So, you know, that sums everything up. Like I said, the patient has led not just the surgical innovations, but also the new technologies, which has really put us to the place where we are nowadays when you think of modern cataract surgery.
So, I mean, I hate to kind of ask, but what's the best out there right now? What are you seeing a lot of, or what are patients really interested in learning about?
That's the great thing about ophthalmology. It's always changing, and there's always something new. And we've seen lots of different lenses, and when I say lenses, I'm not talking about, you know, contacts or glasses. I'm talking about the lens that goes in your eye.
Okay.
And so the natural lens that we're born with, as you know, it hardens through life, and we get in our 40s, we lose that ability to look up close. So I'm 48, so I have to use cheaters now. I'm reading, and so I appreciate the frustration with that, my patients. But there's lenses now that my 80 and 90-year-old patients have much better reading vision than me, because these lenses offer them near, intermediate, and distance. And they're not new. We've been doing those for about 2 decades, but they've definitely improved over those last 2 decades, and the ones we're using now are by far the best we've had. So that's exciting. And it's not for everybody, so we have to do a real thorough exam, see what lens is going to match with each patient, and because it's not the, you know, one doesn't fit all. So we have a great team, and they're basically listen to the patients, listen to what their lifestyle needs are, and try to match that up, and that's obviously very exciting to do.
Oh, you know, you were touching on all of the advancements that we see with lenses. Let's talk a little bit about, you know, glaucoma. You brought up the aging element. What are people seeing as far as advancements go? What can patients expect if they do have that diagnosis?
Yeah, so glaucoma is obviously elevated pressure that can potentially cause damage to your optic nerve and then subsequently lose your visual field. And it's not replaceable like cataract, so you want to stop it before it's significant. Historically, glaucoma surgery has been basically reserved for someone who doesn't respond to drops or doesn't respond to a laser. So it was the person who had more extensive glaucoma. What's turned the world upside down in glaucoma is MIGS. And MIGS are micro-invasive glaucoma surgery, or minimally invasive glaucoma surgery. The reason it's changed everything is, instead of waiting till someone has extensive damage for surgery, because the surgery was relatively invasive, we're targeting patients who are mild to moderate. So they're just using drops, and they maybe want to lower the pressure some. They want to a safer level, or maybe not take that drop. And so MIGS is a procedure that we do at the time of cataract surgery, because we're already in the eye. We have access to the place where the blockage is occurring, the reason the pressure is going up. And so for very low risk, we can do this procedure. There's several different options, and lower that patient's pressure. And so nowadays, with as expensive as drops are, and compliance issues. It makes all the sense in the world for a patient who doesn't have advanced glaucoma but has mild to moderate glaucoma to have a MIGS procedure done at the same time as their cataract surgery. So they can go in and they can get better vision without the cataract and get less dependent on glasses and less dependent on the drops.
Well, so again, you know what? You guys definitely stay on top of all of the cutting edge equipment and definitely work with the patients. If you want more information, there it is on your screen. And a big congratulations for 50 years as well.
Thank you.
Thank you.